Order. Question number 4, Dr. Jian.
Thank you, Mr. Speaker. My question is to the Minister of Health and asks what investment is the government making in Budget 2014 to improve health outcomes for children?
Honourable Tony Ryle.
Mr. Speaker, the government's investing $90 million over 3 years from the 1st of July 2015, so primary school-aged children can go to the doctor for free at any time of the day or night and get their prescriptions for free as well. This builds on the success of the free GP visits and prescriptions for children under 6, including free after hours. Thanks to our prudent management of the health budget, we can now extend this policy to all children under 13, and that is what careful financial management of the country's finances can deliver for Kiwi families.
Supplementary question, Dr. Jian.
What recent reports has he received on the new policy to provide free GP visits and prescriptions for under 13s?
Well, Mr. Speaker, this policy has been widely welcomed in the health sector, including the Medical Association, the Paediatric Society, the College of GPs, the New Zealander of the Year, Kaitaia GP Lance O'Sullivan. I've also seen a report that somewhat begrudgingly described the extension of free GP visits and prescription as, quote, an attractive policy, unquote. And that was from the Leader of the Opposition, David Cunliffe.
Oh, that's sweet.
Supplementary question, Barbara Stewart.
Thank you, Mr. Speaker. What will the government do to improve the effectiveness of the rheumatic fever campaign, given that a recent study has shown that fewer than 1 in 3 children who are prescribed antibiotics for rheumatic fever had taken the full course?
Mr. Speaker,
Honourable Tony Ryle.
The government's investing $20 million in expanding the rheumatic fever program in this year's budget, and one of the items that money will be invested in is improving adherence and looking at new and innovative ways that we can encourage that.
Supplementary question, Dr. Jian.
Thank you. What other initiatives announced in the budget will support the good health for New Zealand children?
Honourable Tony Ryle.
Oh, well, thank you, Mr. Speaker. It's really more good news for Kiwi families in this year's budget. Very positive announcements. Well, the $20 million for the rheumatic fever prevention program extension, talked about earlier. $6.3 million to provide bilateral cochlear implants for children, and $40 million for the new Healthy Families NZ anti-obesity program to help encourage more New Zealanders to eat healthier and exercise more.
Oh, very good.
Supplementary question, Barbara Stewart.
Thank you, Mr. Speaker. What is the Ministry of Health doing to ensure that GPs consistently prescribe adequate courses of antibiotics for rheumatic fever? For example, 10 days rather than a lesser amount, which is sometimes the case.
Honourable Tony Ryle.
Oh, Mr. Speaker, the Ministry of Health is working very actively with the general practice community in order to improve services for kids who present with sore throats. One of the things that we're funding out of this $5 million a year, $20 million over 4 years in this year's budget, is the expansion of drop-in sore throat clinics. Most of these are based in general practice. They are free, designed to encourage people to present and then get the various antibiotics and medications that might be required after that.
Very good.
Supplementary question, Honourable Annette King.
Mr. Speaker.
Order.
Sit down, Sonny.
Order. 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 And the member. That is the sort of disorder that's created by an interjection from my right-hand side, and it will cease. Supplementary question, Honourable Annette King.
Mr. Speaker, in light of the New Zealand Medical Association saying they need more detail of the policy, how many consultations per child per year on average did he base his announcement of $30 million a year to pay GPs for free doctors' visits for children under 13 years of age?
Honourable Tony
Mr. Speaker, as the member knows, we'll be entering negotiations with general practice on that, so that information would be commercially sensitive at this stage. But what I've got to tell that member is I don't know why she's so opposed to this policy, because when I was meeting with general practitioners in her electorate at lunchtime, they were very supportive.
Question number 5, Grant Robertson.
Thank you very much, Mr. Speaker. My question is to the Prime Minister. Was a staff